Today we're going to talk about cholesterol. Cholesterol gets a bad rap because it's what fills in the damage in your arteries and causes plaques, but it's actually trying to repair your arteries. What happens with your arteries is you get damage from high blood pressure, shearing stress, inflammation, all kinds of things that cause damage to your blood vessels. Then the cholesterol packs it in and tries to help it heal. We know, though, that if we lower your cholesterol, we can lower your risk of heart attacks and strokes significantly. So that's why we focus on cholesterol. Now, there's a number of parts to cholesterol. The one that we obsess with and focus the most on is LDL. I call it LDL, or lethal cholesterol. It starts with an L. It's the bad cholesterol. So the bad cholesterol, your LDL, is the one that correlates the most with heart attacks and strokes. We know that under the level of 50, people who have an LDL under 50, no heart attacks or strokes happen. So our goal is usually to try to push it down and lower it, especially in people who are high risk who've already had heart attacks or strokes. If you have stents or open heart surgery, or you've had a carotid endarterectomy, AAA, abdominal aneurysms, or atherosclerosis in any of your arteries, including peripheral arteries, or if you have diabetes, you're considered at higher risk. Your cholesterol needs to be much lower than the average person's cholesterol. So we focus on that LDL. Now the healthy DL, or HDL, is your good cholesterol. The good cholesterol counteracts the effects of the bad cholesterol. It goes to your plaques and goes to your arteries and helps pull some of that bad cholesterol out of there to help to stabilize plaques and kind of soften them up and lower the burden of your plaques. So we try to focus on raising HDL. There's only a few things that can raise your HDL. One of them is exercise. Statin medications can do it as well. And the other one is niacin. It's a B vitamin called niacin. They can also help raise your HDL. Moderate amounts of alcohol have also been shown to be able to do this, but you can't really prescribe that to people because alcohol is a toxin, and usually that causes a lot of other problems. It's a cardiac toxin. The other component is something called triglycerides. Triglycerides are a fatty acid connected to three sugars. People who have diabetes, or people who have diabetes, they have high triglycerides. Now, some people have a genetic disorder with high triglycerides, but for the majority of patients, their triglycerides are high because their blood sugars are running high. You'll find that once you treat their diabetes and get their blood sugars under control, that all of that triglyceridemia, or high triglycerides, will get much, much better. So we're very strict about getting people's blood sugars down. We want to see them down and well controlled for their cholesterol. The other problem with diabetes is it's an inflammatory process. It's what's causing damage to your blood vessels to begin with. So we want to get that controlled as much as possible to reduce the inflammation. There are other inflammatory processes like rheumatoid arthritis and other rheumatological diseases, lupus and whatnot. Rheumatologists help us a lot, but people with rheumatological disorders and other inflammatory disorders get heart disease 20 years before everyone else in their age bracket. So we want to try to reduce this as much as possible. The other thing that really causes inflammation and messes with your cholesterol is smoking. Smoking has a huge impact on your arteries and plaque formation and calcification. Your arteries are hardened and calcified, and that causes heart disease and stroke all the time. So we try to focus on helping people get their blood sugars down, quitting smoking, getting their cholesterol down to acceptable levels, and then just adopting a healthy lifestyle in general, eating all the right foods, and exercising and staying active. The food you want to avoid the most, patients ask this a lot: what can I eat to make my cholesterol lower? Well, first of all, even if you ate 100% perfect and you exercised every single day like we tell you to, you can only lower your cholesterol by about 16 to 18%. The best studies have shown that exercise and diet alone lower your cholesterol by about 16%. So it's a genetic disorder. There's nothing really you can do about it by altering your lifestyle. Statin medications do a really good job, but the one thing you want to watch out for when you look at labels and try to decide what to eat, it's not the cholesterol in the food that is causing your cholesterol to go up. That's about 10% of your cholesterol. 90% of your cholesterol is made by your liver. So you want to avoid something called saturated fats. Saturated fats are what really raise your cholesterol. And saturated fats, the easiest way I explain this to patients, is they're fats that are solid at room temperature. This is like your butter, your chicken skin, your bacon, your cheeses, most dairy products, your creams and your ice creams. Now, those are liquid fats if you think of milk and cream, but those are little fat solid particles in an emulsification. They're floating around in milk. So it's a little bit tricky with dairy products, but it's another one you got to remember. But the fat on steak, the skin on chicken or turkey, all of those things, any solid fat. Now, recently they found that if you want to fry your foods with liquid oils like olive oil or peanut oil, whatever you want, you can do that. That's not contributing to your cholesterol, but it is adding calories to your food. If you took a chicken breast or a chicken leg and you fried it, you're infusing it with oil. And oil is very, very calorie dense. That's why we don't want people to fry food. It's not that it's going to affect your cholesterol a whole lot, but it'll actually give you a lot of unnecessary calories. So that's why we tell people to avoid fried foods. But if you are going to fry food and you want to every once in a while, please use liquid oils. Don't use butter or margarine. Don't use lard. Don't use bacon fat. Don't use any fat that starts out as a solid at room temperature. It's the best way to remember this. So I hope I hope you understand your cholesterol a little bit better. If you have any questions, please feel free to contact me. I'm available on all sorts of social media, and subscribe to my channel as always.